In India, we are in a very strange situation. We have the best doctors, the world-class technology, everything is available, but not to everyone. The problem is, for 2000 people, we have just one doctor. One of the lowest ratio of doctor to the population in the world. And it is so strange that most of the super specialty and the best of the doctors are all concentrated in the bigger cities where the facilities and the technologies are easily available. But the rest of the 60 to 80% of the population living in the villages or the remote places are just unable to have an access to the best of the doctors in the country. And as a result, on one side we have in plenty of advanced technology, and other side there is so much of need for the really poor patients who really require the opinion and the treatment from the really good doctors. So the problems are plenty in our country, the solutions are very scanty, and the results are becoming empty. And the only solution for this, as we see today, is the telemedicine, which can bridge the gap between the need and the availability. And the telemedicine is such a beautiful thing. It is not only for the short-term solution, it is also for the long-term solution. For example, a person who's living in the remote place, he just can't afford to spend money for traveling thousands of miles and go to a place, a remote place or a bigger city where he knows no one. And when nobody is there for his help to get the treatment and then come back after the surgery or some treatment or radiation or the cancer therapy or the bypass surgery is so difficult. It is almost like doing a yajna for the people who have to travel all the way from their remote places. Large number of doctors who are good with excellent ability and the facilities and the infrastructure are all concentrated in the bigger cities. Obviously for the logistic reasons as well as for their own career. And you just can't blame the doctors for not going to the periphery. For years together, the politicians, for decades they have been telling that doctors should go to the periphery, go to the villages and treat the poor. But it is not possible. See, advising is very easy, but when it comes to real practice, it's almost impossible. And as a result, there is a big gap between the needy and those who can care. And my own experience as a general physician for 33 years, and then the cardiologist, and then the pediatric cardiologist, and that too an intervention cardiologist, pediatric cardiologist. Hardly there are few centers, the 2 or 3 centers in the whole country. And I get the patients all over, right from north, west, even from the other countries. But the problem is for them, even the small things, they just can't afford to travel all the way to get the opinion or what they have to do. And the telemedicine or the integrated healthcare system exchange is one of the excellent solution for this, because all of us are very busy, agreed. None of the super consultants are available to an ordinary person, but all said and done, in spite of our busy schedule, we can afford to have some time in our life or in a daily routine life to spare for the needy from the periphery or the poor. The poorest of the poor, if he has to get the opinion from the expert, then this integrated health exchange comes very handy. A person who's sitting in a big city can talk or look at the investigations or discuss with a person who's treating the person in the remote place and then give the opinion. The best solution can be given to the patients. And that way, lots of problems. In my own 33 years of experience, I have seen many patients when they come to the tertiary center, they sell their land, they sell their everything, they sell their house, and they have nothing to go back. Even to go back to their own place, they don't have money to buy the ticket for the return ticket. And it is so pathetic, and it is so touching, and your heart goes out to these poor people. And as Bill Gates said, the technology has to be like an open book. It should be available for everyone. And unless this is available to everyone, even in the remote places, the poorest of the poor and the neediest of the needy persons, then this technology of no use. And hence, personally I feel, see, having done the rarest cases in the world where the mother had lost the previous child, the next child just 14 hours old, there was a critical pinpoint aortic stenosis, the child was brought in the ambulance with the ventilator, the child had not cried after birth, and then I had to cross it with the guide wire and dilate it with a balloon, and the child survived. So it is literally life saving. Some of the tertiary care, the techniques and the technologies that are available today in almost all the super specialties are literally life saving. And if this technology technique has to reach to the poorest of the poor, there has to be an integrated medical exchange program, and that way each one of us, we can say that the poor patients may be victims of their fate, but let them not be victims of our negligence. And in that direction, it is the duty and the bounden responsibility of each doctor to spare some time every day so that they can have, through the telemedicine, give their wisdom, the wise advice, and whatever they can afford to the patients who are living in a remote places for due to some reasons. Everybody can't concentrate in live in the cities, and those who are in the periphery, it is our duty to see that the best treatment medicine is available to them, and that can be made possible only through the telemedicine. And hence I feel and request that every person in the medical fraternity to come together, join hands to see that this telemedicine is utilized for the best of the humanity and to give the healthy society, and the poorest of the poor is given the best treatment wherever the person is living.